It is my distinct honor and privilege to welcome you this morning to this National Validation Workshop for the Draft National Health Insurance Policy. We are gathered here today at a very important moment in Botswana's health sector reform journey, a moment that calls for reflection, collaboration, and collective action. On behalf of the Ministry of Health, I would like to extend a warm welcome to all stakeholders who have joined us today. Your presence here this morning is a clear demonstration of your commitment to strengthening Botswana's health system and improving the lives of our Botswana. This workshop is convened to validate the draft National Health Insurance Policy, ensuring that it reflects the views, priorities, and realities of all key stakeholders before it proceeds to the next stage of national policy legislative process. Ladies and gentlemen, the diversity of stakeholders here present in this room is both intentional and very, very necessary so that we do have a policy that is inclusive. It requires government leadership, private sector participation, technical expertise, and importantly, the voice of the ordinary Motswana who is out there in maybe in RACOPS or in Palape. Today's workshop, therefore, represents a shared national platform for shaping the future of the healthcare in Botswana. Allow me at this stage to recognize and acknowledge the distinguished dignitaries present with us this morning. We do have the Honorable Minister of Health, Dr. Stephen Modise, who will deliver the keynote address and officially guide us through the government's vision for the national health insurance. We have amongst ourselves Mongaro Nakosi Malope Wabobedi, who is the chairman of Ngwedo Kosi. We do have Ms. Pamela Chisinga, High Commissioner, Zambia, as well as her deputy, Mr. Proper Tembo. We also have Yvette Hasselman, Deputy High Commissioner, Namibia. We have Ms. Young, UN Resident Coordinator. We do have Dr. Fabian Ndenzako, WHO Country Representative amongst ourselves. We also have Ms. Lisa Esapa, Deputy Country Director. We also have our mother amongst ourselves, Special Ambassador for the ALMA, Professor Sheila Tlo. We do have our acting PS, Dr. Mfogeng amongst ourselves. We also have Mr. Moraki Mokosana, who is the chairperson of the BB, or Business Botswana Health Sector, as well as the MD of BOMAID. We do have Dr. Somalukai, Gloria Somalukai, who is the Executive Director of BITBA amongst ourselves. We have permanent secretaries and senior government officials as well, and representatives from the private healthcare sector and the medical aid industry. Members of the NHI steering committee who have helped us to get to where we are, together with the members of the reference group who has helped us with the formulation of this policy. We do have development partners and technical experts who continue to support Botswana journey towards universal health coverage. All stakeholders and participants whose insights and contribution has shaped the policy that we are going to be looking at today. We are truly honored to have you in our midst this morning. Ladies and gentlemen, as we proceed, it is now my pleasure and honor to invite the Honorable Minister of Health, Dr. Stephen Modise, to deliver the keynote address. The Honorable Minister will outline government's vision for the national health insurance, the progress made